in co-host. My name is Dewanda, and I am the founder of Yanima Healing Circle. And we've been organizing these discussions with community for about 3 weeks now. So the first presentation we had was last weekend. This is a community presentation just to have people be able to open up in conversation and become comfortable about having conversations about the virus and the vaccine. So I'm really glad that you're here. The town hall was great. We had two medical providers, one adult doctor, care doctor, and also a pediatrician. We had Dr. Carol McKinley Alvarez, who's a psychologist with us, and she talked to us about othering and how to be gentle with ourselves and being okay, not being okay during this time. She also brought up some good discussions that we had around being in a pandemic, not only on a world scale, but in our homes as we go through these transitions from the COVID virus. So I have here with me tonight, Dr. Mark Gandy and Professor Mickles. I'm going to give them a second to introduce themselves, and then we're going to share a few video clips from the panel so that you can be refreshed or to hear for the first time what took place during our panel last weekend.
Thank you, Ms. D. I'm Pastor Mark Gandy, Senior Pastor of Miracle Temple in Richmond, and I pastor pastors. I have about 10 churches under my district, and so I'm just happy to be a part of this panel, and I'm happy to have been a part of last Saturday's panel as well. So God bless you.
Thank you. Professor Mickles?
It is so good to be here, everyone. My name is, what is my name? Professor Mickles. You know, you don't introduce yourself, right? So I just like, oh. Anyway, from Contra Costa College, and we minister in health and human services. And I say minister because I believe that it's really important for families to learn about each other, learn about mental health, and learn about addiction studies. And also, I pastor with my husband, Don Sutton, with Resurrection Christian Ministries. And I'm also a part of the Faith Initiative for the vaccine, regarding sharing information about the vaccine and why it's important, and why it's important to communities of color as well as everyone. So I'm really glad to be here and excited about what's going to take place and all of your questions and everything. So I'm glad to see everyone, and God bless you.
Thank you. Appreciate you both coming back tonight. We're going to move. I'm going to turn this over to Ratha just to play a few of the clips for us so we can refresh ourselves on the conversations that went forth last week on the 14th when we had our entire panel here. As I said, we had Dr. Sophie, Dr. Sutherland, Dr. Carol McKinley Alvarez, Dr. Gandy also, and Professor Mickles and I were the hosts of that panel. So we're going to show a few clips from that. Turn it over to Ratha. Get us set up.
Okay, hopefully this works, everybody.
Dr. Alvarez, the other last thing that I would have, do you have any suggestions for the African American community on how to take care of their mental health during this pandemic and the variant?
So I wrote down, I'm now moving my little tablet in front of me because I always love to give tips, right? It's important for us to have tips on what to be able to do. So some of it I've already said in the pieces that I've articulated, which is one, the first thing is to not other, to be welcoming, relational, and engaging. The next one that I wrote down is important for us as African Americans to be informed. And we need to be informed by people who know and understand us. Please do not believe everything that you see on social media. I know that we all are great in investigating things and putting memes on, and all of a sudden that becomes our truth. But we need to be informed in a real way, but again, informed by people who know us, because who we are as a group is very different than other groups. I also put down for us as African Americans, it's okay to ask questions. It's also okay for us on our psychological level to say, yes, I have been psychologically impacted by what is going on in this time. I have been. My mental health has been impacted. We want to make sure that we do our social distancing, but stay connected. And the last thing I wrote is that we should validate people's fear. I don't mean validate it in the sense to say, yeah, what you believe is true. But the only way that we can actually have a conversation with someone is if we first acknowledge that their emotional response is true for them,
Yes.
and then be able to move accordingly in that conversation. And then lastly, it's okay to seek support. Please seek support. There are all kinds of therapeutic services that are out there. During COVID, some of you know that my family had a loss and we lost our daughter, our youngest daughter. And I went online, received telehealth, looked up a great online mental health service for grief and loss, and had 8 sessions. I'm not saying that's the only amount of sessions you need to have. And boy, did that was a life changer for me. Yes, we need to be mindful of our health. Use telehealth if you need to. Go online. But please, your mental health actually drives so much of your physical and other levels of your health. It's okay to seek help.
That was from Dr. Carol McKinley Alvarez, who gave us some tips on self-care around our mental well-being. I see Dr. Sutherland has joined us, and we want to welcome you in. So did anything come up around the tips that Dr. Alvarez just gave for you all? Has anyone found that they needed support during this process? And I'm not talking about just in the last month or two. I'm talking about throughout this whole process, from the shutdown, when we had to isolate and be at home more so. How did that go for everybody?
Me personally, I do have a therapist who is not only a trained licensed therapist, but she's also a minister. And she checked up on me about a week or so ago. And that is something that I can really appreciate. I haven't suffered a loss from the pandemic, but I did suffer the loss of my mom. I lost my mom in January, and she was 88 years old. But still, I hadn't really had time to grieve. And so, so this whole pandemic, along with the loss of a loved one, it is very taxing, especially on someone in ministry, where I'm expected to be the strength for my people. Then I need someone to kind of be there for me when I'm in need. And so, thank God I have a good therapist, and she understands the pastorate. She understands what we have to go through and what we deal with. So that makes a difference. So I think the advice that we received from Dr. Alvarez was just spot on.
Yeah, what you were talking, and you're talking about the grief that we had already in our lives prior to the pandemic taking us out of circulation and then keeping us more homebound than anything. We've also had some other major events that took place in our communities when we had I just call it the day the earth stood still, but the day that the sun didn't rise. We had so many catastrophes naturally taking place that it just kind of sent me back. I live in a location where I can't see or hear traffic. So from that day forward, it was a little edgy. But then here, right behind that came when we went to the shutdown. And I remember being in the house one day and I said, I need to go outside because I don't know what's going on in the world anymore. I don't partake of a lot of news, but it was just being in this house by myself that I had to go outside and see what was going on. And it's okay, as Dr. Alvarez said, to not be okay. I wasn't okay because I felt so very out of touch with the world that I'm used to being a part of every day. Did anyone else have this experience? And this is an open conversation. We're not doing lectures tonight. We're not disseminating information. We're setting a place where we can talk about our own personal experiences and begin to do some restorative stuff within ourselves. Because if any of you have any kind of experiences like we've been going through, there's a time that we also have to get to a place of restoring ourselves to wellness so we can make those next steps that need to be done in order to continue to live life as such. Because I hear people a lot saying, we want to get back to normal. This is our normal. We've been doing this for well over a year and a half. So we may not have what we had a year and a half ago ever again in the cycle of this life. So does anybody else have any comments or anything you want to share?
I appreciate Dr. Alvarez reminding us to seek help. It's our line of work, but yet it's really important for pastors, ministers, doctors, lawyers, everybody to seek help because we can't do everything by ourselves. And I know that my family was impacted, loved ones coming with having COVID, and but yet being so lonely that they wanted to come home in spite of. And it's very difficult, but also the racial injustices that were going on all at the same time, so much going on. And even though I know self-care, I found myself lacking in doing exactly what I know would help me. Like you said, going outside, my thing is to run, but I find myself just staying in because not being sure of what was going on. So I really appreciate those reminders. We need tips, we need reminders. Even if you're in the professional world, you still need to have those fresh reminders. Even if somebody can just say something just like she did, like Dr. Alvarez did, and then it's like, that's right. Remember those things. Remember those things because they're so important.
Thank you, Professor. Aaron, you want to join in this conversation? Share a little bit with us?
Let me start my video. Yeah, I had to work through the whole pandemic, and it was very frightening at first, at my age and hearing about all the deaths and the people in the hospitals and having to go to work and be around people all day. And that just was terrifying. And, I'm in recovery. And so I was able to kind of, it's not therapy, but I do have a sponsor that I was able to talk with about my fears of going to work and actually catching COVID and maybe even dying or maybe going in the hospital and your family don't get a chance to come see you. It was just a whole bunch of fear around it. And I am one of the people too that I do believe that I can be okay when things are not okay. And I really was glad to hear Professor Alvarez mention that too, that we can be okay even when things aren't going okay. And a little bit of that advice of maybe getting a therapist, boy, that probably would have helped me a lot, in the beginning when this thing first started. I probably had that pride, I don't need one, but listening at some of the stuff last week, a little therapy would never hurt. So thanks.
Thank you. Alexis, how are you tonight?
Hi, Auntie Dewanda. I'm doing pretty good.
Anything you want to add in?
Sorry, I'm listening from the nail shop. I do apologize about the noise, but I do appreciate being able to be a part of this group and being able to get more educated on what the vaccine is doing for us so that I'm able to speak to my peers about it. I had a conversation with one of my close friends and I asked, why are you afraid of the vaccine? Sorry. And she advised me it's because she isn't educated about it. So I'm able to get information that I didn't know and spread it to my peers. So I do appreciate the conversation that I'm
What's your
included in.
age group too?
My age group, around 30, 25 to 30.
Okay, thank you. I appreciate you because last week you sent a message and said because of what you learned, you were gonna talk to some more people in your peer group. I think that's great.
Yes.
Thank you so much. I'm glad you were able to make it.
You're welcome.
Okay, Mr. Evans, can you share with us a little bit while you're driving? Would that be, are you like in a lot of traffic? Are you gonna be safe? You're on mute.
Sorry about that. No, it is safe for me to talk. I am in on Highway 80, but I wanted to sit in because there's a lot of people, especially at my job. There's still people that are afraid to get the vaccine because they don't know what's in it. And well, I'm not a doctor, and most of the shots that we get, the medicines that we take, we don't know what's in it either. But we still take it, and we trust that our doctors are doing what's right for us. But I think there's a lot of mistrust from our community, which needs to change because the science is the science. I know several people myself that have passed away from COVID-19, and they're still dying. As a matter of fact, one of our drivers in Oakland who refused to get the shot died just on last week. So it's real, it's out here, and we needed to educate ourselves. And me, as an essential worker, I never stopped working. And I think for the mental health on my part was I didn't stop working, and it was business as usual. And as a matter of fact, I worked more hours last year than I did the year before that. But it got personal because last July, I thought it was safe to go out and go fishing. And I ended up catching COVID because my brother, he almost passed away from it, was in the hospital, and he had it and didn't know it. I got a very mild case. I was asymptomatic and was able to fight it off. And by the time I got my test back, it was already 14 days in, and I was already ready to go back to work. But once the shots were available, my entire family got the shots, and no one else in my home got COVID.
That's wonderful.
So I'm just thankful to be on here. I mean, what kept me sane, I think, is all the projects and honeydews. My wife's an introvert anyway, so she doesn't want to go out anyway. So that was right up her alley. But I mean, I was able to do a lot of work around my house, just me. And I think that's what helped me. So it's good to be on the call. Thank you.
Thank you. Dr. Sutherland, how are you tonight?
I'm doing great. Happy to hear that there was some positive changes for people and sharing the information about being vaccinated and, wanting to reach out. Because I think somebody said that last week, what's going to help? And we said peer-to-peer, because anytime you know somebody and it's more trustworthy because you say, I trust them, so when peers, we talk to our friends and neighbors, that really kind of helps. But for me, the COVID pandemic, you're asking how did I do with the pandemic and those types of things. I think, there was obviously loss, had some death in our family. One of the most challenging ones was one of my cousins in her early 30s was 36 weeks pregnant and got COVID in December, when the pandemic was really raging, and they were able to save her baby. But my cousin did not make it, and we buried her on December 27th. So that was a big blow. And, I often think about when people say, oh, this is not real. You say that until you're looking, at loss or, and, being a doctor, obviously used to treating people that are sick, but this was something that was really different. So, there was loss, but also for me, like Mr. Evans was just saying, he enjoyed being able to do things at home. For me, I actually enjoyed the slowdown that the COVID pandemic brought, because I have a very busy household, and seemed like we would run between Oakland and Vallejo on a regular basis during the week. So in some ways, it made us stop and do more family-oriented things and slow down. Got, very familiar very quickly with Zoom, and have a large extended family. And so we were able to spend Christmas together when we never would have been able to do that, right? So there was, some things that were really positive and gave us time to kind of stop and breathe and regroup and touch bases. And for that, those kind of things I'm, thankful for. But, the challenges of the unknown, especially at the beginning, working in healthcare and knowing that you have to go in there and you have to do the work, but you're not sure what you're dealing with either, is challenging, I think. But that's it.
Thank you.
Mhm.
Mr. Ward, how are you tonight? Maybe he's not there. And by example, and I don't think they ever got connected audibly. Miss Watley, how are you? And how has this experience been for you the last year and a half? M's iPad.
Hi. I'm in the beginning, it was very overwhelming for me because of the population that I work with. And that was one of my biggest concerns. And I still have anxiety around it. It's just my anxiety is getting better, but I still have my concerns with going out. I'm getting to where I don't want to go out at all now. And that's not me at all. So, I'm just trying to take one day at a time. Thank you.
Thank you. That's
You're welcome.
thank you for sharing your truth. That's really important and very relevant in this time. As Dr. Alvarez says, it's okay not to be okay, and it's okay to talk about it and to get support around those things when they come up for us. Ratha, but before we move into another clip, I wanted to ask Dr. Sutherland, just briefly, could you tell us like what might be good things to say to people when they ask us questions like Mr. Evans mentioned, we don't know what's in the vaccine. How would we respond to that? Well, be something we could say to like that other than, yeah, well, you don't know what's in the medication you're taking. What would we say that would help ease into a conversation beyond that?
Well, I thought of something kind of, I think I probably would say, that's a really great question. What is in the vaccine? Because I think like we don't want people to feel bad about asking. I'd rather people ask questions rather than they don't want to ask questions. And then I'd have to do what I had to do. Let's Google it and see what's in the vaccine. And there is a list of ingredients. I literally just Googled that a minute ago, the CDC, and it's all chemicals. So the thing about it is when you look at the list, it doesn't really mean anything to people. So I would say, let's look and see. And then what do you need to know about what's in it that would have made it, did that make a difference for you? That's kind of what I would say. Okay, here's what's in it. Now, how do you feel? I think, people ask all the time, and it is true. I mean, we take medications, it's all chemicals. So it's not really any different than other things that we do. But let's look at what is your, concern about it. The whole thing about people getting chips implanted, that's a lot of things that people were afraid of, or turn into green monsters or whatever. And, people sincerely believe that. So, I go back to, there was a lot of research that was done a long time ago, and that, my thing is they tested this on a large number of people before it was introduced. Also, too, something that people would say, well, they didn't have Black people in the studies, but actually they released all the, there's data about, the race and ethnicity of the people participating in studies. It was about, I think about 16 to 18% of those in the vaccine trials were African-American, which is, they say 12% of the population is African-American. So they really did, to me, a good job of trying to, do this in the right way to reflect the country that, we live in. So for me, I guess I would just say, here are the ingredients now, is there something else that might be blocking you from wanting to get the vaccine? And
yeah, I think that was really great, because we kind of touched on that last week when we had the discussion, knowing how to have conversations and being able to lead into other questions that we can follow up on, versus with a response like, well, you do this, and that would stop the conversation right there. What you said is that that's a really good thought you had, to ask those questions and then to both go and explore, and then coming back with more questions like, okay, so now that we saw what's in there, and we may not even understand the medical terminology, but what do you have? What is it that may be keeping you from still hesitating to do the vaccine for yourself? What now? And we just keep generally exploring until we can get to an answer. I think that's really great. And it helps to keep the conversation flowing. Thank you so much.
you're welcome.
Did anybody else agree with that? Or, go ahead, Mr. Evans.
I have a quick question. So the hot topic of the day now is that masks don't work, and in certain circles, they're demanding that their freedom is being infringed on, and by having to wear masks. Can someone explain? Do they work? How they work? And should we be wearing those? Since we have doctors on here, and maybe I can tell someone why masks work.
Dr. Sutherland, or anybody who wants to respond?
I'm happy to give my 2 cents, and if anybody else wants to respond. I wish I had this photo. I saw a photo sort of early in the pandemic that showed what happens. And I think I might have a screenshot. I'm gonna have to search in my files here to see if I can find a screenshot. But yes, masks do work. It's a barrier, right? It protects the exchange of body fluids from one to another. I mean, before the pandemic, we've seen those commercials where somebody sneezes, right? And you see all the particles. So again, this is not something that's new. This is something that we've seen before, and we know that happens. And so by putting the mask on, that eliminates your sending things out as well as things coming in that we don't want. So I'm not sure who is saying that masks don't work, because they do. Are they 100% effective? No, because as we talk, of course, the moisture from our, mouth, and you can't, masks can get soiled and might, leak or something like that. It's not 100% effective, but it's a strong barrier. And it definitely makes a difference in conjunction with, not being right on top of people, 6 feet, quote unquote, social distancing. But again, I think, to me, the bigger issue is around personal choice and my independence as a person. I think what you said, people saying they're making us do this, or I don't want to wear a mask anymore and you're forcing me to do something I don't want to do. And that is a challenge that, we need to know how to talk to people about masking. I could go on and on, but I'm just wondering if anyone else has something about how they would deal with, I don't want to wear a mask.
Again,
Curious.
this is Pastor Gandy. I
Yeah.
thought about the, I guess when we're told click it or ticket, when they talk about buckling up, we know that the seatbelt doesn't guarantee that we will survive an automobile accident, but it's something that I guess the safety regulators have deemed that it's mandatory for everyone. Even children in their car seats have to have a restraint. So you could use that argument. You could use the argument that in the state of California, motorcycle riders it's a mandatory law that they wear a helmet. The helmet's not going to necessarily prevent death or fatality in a motorcycle accident, but it's like you said about a barrier. It's a precautionary measure, and so you could look at it in those terms if the person is reasonable, if they use reasonable reasoning skills. So that's just something I was thinking about earlier today, even. So.
Yeah, I think that's a great point about the seat belts, the helmets when the kids ride the bicycles. I was a kid, we didn't have to have a bike helmet. Right. Now the kids, they just do it. They don't even question it. So a lot of things that people used to, not feel was needed, that are safety things, right? And there's reasons why these things have been mandated, to protect us. So I like the idea about, would you drive in a car without a seatbelt? Would you? I also was thinking, for me, my whole thing is, I'd rather err on the side of caution and prevention rather than hope that I can get out of an ICU bed.
Yeah.
So to me, a mask is very minimal ask for me.
Yeah.
And sometimes, people do get tired of the thing. You can pull it down for a minute. You can take a break for a minute. You can be outside for a minute. I get that. But in general, when I see people out without masks, it makes me feel uncomfortable because I don't know if you're spreading COVID. I mean, I want my own protection, right? So I don't know. Anybody else have an answer to that?
I'm okay with the mask, and sometimes I wear 3. It depends on where I'm going. I work in a population that I really have to be aware of what's going on around me and who's there. So a few days ago, one of the clients came in and she had her mask like off, half off at least, and every time she got ready to talk, she pulled it down and pulled it back over her mouth only. And when I asked her, would she please completely cover, she got really offended. And I explained that it's for my safety as well as hers. Well, I'm vaccinated, but still, we can still spread this. Would you please put your mask on? I see a lot of people will like have masks like all day long. So that's not that effective, is it? I mean, because you can breathe this in while you're half masked to be comfortable, but you're not putting that barrier between yourself and other people. Is that correct?
I agree with you. We're supposed to wear it fully covered and to protect ourselves. I agree with that. The mask hanging around the mouth and, again, it's kind of a thing that, people want to do, sort of that autonomy type situation.
Another thought I had is when they talk about how uncomfortable it is to wear the mask, but consider if you have to be on a ventilator.
Hmm.
Consider the comfort of being on a ventilator. There's no comparison. So, that's a harsh reality, but it's true. A friend of mine, I was, talking about what Brother Evans mentioned, that same UPS driver, he was a very good employee. My sister, he delivered to her office building in Oakland, and she was just devastated that he was gone because he was, such a family man. And so when I just heard that he wasn't vaccinated, that kind of shocked me because I would have assumed that he was vaccinated. So you just never know who is or who isn't. Even in my position at the church, when we have visitors and people coming, we don't ask them, are you vaccinated? Or are you, we that's not something that we ask. We just, make sure that everyone is masked and that they follow the other protocols. But, it's not even about vaccinated versus non-vaccinated, but it kind of boils down to that when they're not practicing safety measures such as distancing and wearing the mask along top of that. So yeah.
And Alexis or Miss Watley, do you have any comments around the masking? And also just consider how we go out on events and we're outdoors with people and we're unmasked, in close proximity sometimes because, we're outside. So we feel a little more comfortable with taking off our mask, but even that can be, we should take precaution at. That's what I should say versus that can be risky. Either one of you want to comment on the mask situations?
This is Secondra Watley. I don't have any questions or comments at this moment.
Thank you.
You're welcome.
So for me, I think that the biggest concern is that a lot of people that I do speak with, they don't know the seriousness behind the whole pandemic and what's going on. So when they come up with the whole mask, it's all a joke to them. So I have more of a question. How do we stress the seriousness behind what's going on?
From a person to person. Sometimes for me, I share my personal stories and things I've seen in the community happening with people I know. I don't tell give their identities, but I know that in my community is a hot spot. And I know 2 or 3 people who have died from COVID, and just try to be actively listening to them while I share the story of what's going on, my own personal experiences. And I met some people in your age group that have had COVID, and they are open to talking about it. I think that sometimes that we just have to start a conversation like, so what do you think about this? And start that conversation, like the doctor said, just keep it open-ended and generate a conversation. When that one is finished, ask another question behind it. So what are you doing differently? And especially for young parents, how are we making sure that your children are protected? If you're in a place where you haven't made a decision yet to take care of yourself, there used to be a commercial that used to be on when women were in a domestic violence situation. And it would say, if you can't do it for yourself, do it for your kids. So sometimes we have to talk about that too. Like, how am I going to protect my children that I send to daycare or to school every day? So just try to ask questions and share your concerns about what's the possibility if you happen to get COVID, how would it affect your children?
Can I ask a question? Why do you think, Miss Alexis, people don't think this is serious? Why do you think that, they feel like that? Or
in your age spectrum?
Well, I've had multiple conversations with a lot of people, and they feel like it just came out of nowhere. Like all of a sudden, this disease or came out of nowhere. And now I'm like, one person I spoke with, they said that it was one of the ways to get our population down, and it's all by the government. And for me not to be fully educated on what exactly was going on, I couldn't say anything back. I was just like, okay. And, so a lot of times I have conversations with people who just, they come up with their own theory on what's going on because of how quickly it happened and how it happened out of nowhere.
Thank you, Alexis. And Doctor, and anyone else who would like to come back and respond to that coming out of nowhere. Did it come out of nowhere?
Well, that's a great one. Let me see if I can come up with an answer. Well, you know, the COVID is part of that SARS family of viruses. And so we've dealt with other members of that family. This happened, I don't know, about maybe about 3 to 5 years ago, where it was the SARS virus. This COVID moved quickly and yes, became a worldwide pandemic, but we had Ebola. We've had other viruses that we were able to contain and just didn't catch on like wildfire. Unfortunately, because maybe, I don't know, I can't speak to that, but for whatever reason, this one traveled quickly around the world. And I think, perhaps there was a lot of hesitancy at first, this isn't gonna be a real thing. There was that instant like culture of this isn't real, or, people didn't take it seriously from the very beginning. But we've had numerous other viruses and threats. And I was also thinking back, it was about the 1900s when that flu pandemic, and they show the pictures of the people and how they have on masks. So the mask thing has been around for centuries, right? That's one of the things that they did back then, again, to reduce the spread. But I would say that's a great question. I don't have a really good answer, except that this is, we've seen other things. I mean, they did a lot of work with Ebola to contain it and not have it spread. We just didn't have that same type of, I think, immediate type of action to control COVID as fast as possible. But again, that's just my opinion. I don't have, since
Thank you. Anyone else have a response or a thought on that? Because we're talking to a young woman in that 30 age group that could help her when she goes back into her peer group to have these deeper conversations. Thank you. So SARS is a part of the flu viruses, is that right? Or is SARS, I'm not sure.
Well, it's a type of virus. It's
Okay.
a little different than influenza. But,
Oh, okay.
But just, I mean, there are numerous viruses that we deal with.
But COVID is specifically from the SARS, in the SARS family.
Mm-hmm.
And I for personally, because we're having this conversation now, and I heard you say that it was the respond. Sometimes people think, oh, it's just going to go away. It's a common cold. It may be like the flu.
Right.
Let's just take this medicine. So it was, and then it just continued to multiply because people were moving around until it got to the United States. And by that time we were in a pandemic. And
Right.
we've had several throughout, but this is the first time, like in our generations that are sitting here now, that we've had to actually deal with a worldwide pandemic. We had the HIV pandemic and other pandemics that spread rapidly also. And again, maybe it was just the way we approach this thing. And by having these conversations in our community now and learning more about how the vaccine works and helps to protect us, can help slow the pace of the spread of the COVID, that can help us start to recover and become virus free, or less activity in the virus, that we can stand through the rest of the time that this virus is going to continue, because it is mutating. This isn't the first mutation, correct?
No, there have been other mutations, but this one, the Delta, is very strong.
Yes.
So it's another, somebody says it's fourth wave we're going through. Right?
Yeah, that's pretty deep.
But yeah, I mean, we've had, we didn't live through these things, the bubonic plague, the I forget what they call the flu pandemic in the early 1900s, smallpox. I mean, this is not new. This is our history now, but this has happened and we've managed to, come out of those things. And certainly when HIV first started, or people said that was, man-made, created. So the same things people are saying now, they probably said that about smallpox and the bubonic plague, but we've managed to get through those things, and move on and eliminate some of them, like smallpox was eliminated. I mean, these things have happened. But for us, this is what we're experiencing now in our lifetime, these situations.
And I think that would be a good talking point of what I got out of it, is that this has happened.
Yeah, I mean, and if people don't remember Ebola, I do. That was about 10 years ago. Remember when that was the whole thing? And, a few cases got in the United States. I remember some hospital in Texas was on the news, and, they did a lot of things to shut down, movement and anticipate. I know our hospital prepared for Ebola, but didn't have to deal with it. So, again, this is being recorded. I'm not trying to take a political stand or anything like that, but I feel like in some ways, you have to act quickly, and maybe people just didn't know. Because I remember it was February, but this is like the flu will be over in April, and here we are 2 Aprils later. We just didn't know. Yeah.
That is
But
so
yeah.
true. So true. Mm-hmm. Dr. Gandy?
I was having a conversation with my mother-in-law, and we were talking about polio. Years, I was a kid, and I still have the little injection site when I got my polio vaccination. Mm-hmm. And we were able to eradicate polio because of a vaccine. So vaccines aren't something new. I was in the military. I got a barrage of vaccinations when I enlisted. That was just a part of protection. So I look at it as protection. I don't think the government I don't think it's a conspiracy. I've heard those views that, we're talking about herd immunity, and they're talking about they're trying to thin the herd. And, that's not, I just don't buy that. They think that it's a target for people of color, but more non-people of color are taking the vaccine than we are in numbers. So I don't think they would be taking the vaccine if it were designed to eliminate one race or another race. So, you just have to, I don't know. I keep using the word common sense, but if sense were common, then everybody would have it, and not everybody has common sense. So, yeah. But yeah, just talking about that, the vaccine and vaccines in general, they have helped us to overcome so many other diseases that have been widespread. So why do you think that this particular vaccine is any different? And that's my question. Why do they think this vaccine is any different than the others that we've had?
Thank you so much, Dr. Gandy. Our time is wrapping up. We scheduled for an hour, and I'm really grateful. I'm open to any other sessions you all would like to have. I appreciate you coming tonight, and I think that that's a good place to leave off at. Vaccines have prevented pandemics and viruses and other diseases from wiping out the whole entire human race. That vaccines have been walked on, and they are changing as the viruses increase and change. So when we look at this with the fear and conspiracy theories that a lot of us have heard, let's look around and really examine the information that's in front of us and see exactly. Dr. Gandy mentioned that there are in certain communities, there's a great deal of hesitancy when in other communities we see people rushing out to get vaccinated. We have to take a look at that. And I'm not saying what's good for the goose is good for the gander, but please take a look at that, because that should speak to us in volumes about missing an opportunity to achieve some wellness and stay well during this pandemic. This has been a scary time for a lot of us because it doesn't affect us until it hits our front door. And then we start to be alert and heightened by the fear or the anxiety that comes up. When we have the information before us and we can make some good decisions on what we should do, let's take advantage of getting that information, and then also have conversations with one another that will help expand our thinking and how to have these conversations by asking questions versus saying something that's just going to close that conversation down. Do some reading and just look into it for yourself. This virus is something we've never seen before. I've read medical reports when my friend was hospitalized with this virus, and when they described like what the COVID was doing in their lungs, in my friend's lungs, it scared me, because they described it, and just as I've heard, it's like shards of glass that runs and it pounds around in your lungs. And if you don't know, once your lungs are scarred, they harden. And then you can't get enough oxygen to pass through the small alveoli, is that I'm pronouncing that correctly, doctor? To get into your bloodstream to carry the oxygen through your body. And that's how people end up on ventilators, and they keep pumping air into them, but it's not going anywhere. And a lot of our community are dying, our family members. So please become informed. Please do not be afraid. I think the greatest thing that this vaccine offers me is a possibility that I won't die if I come in contact and I get COVID. So if that's nothing else that we can look to, we can say that I took this vaccine to keep myself from dying if I happen to contract COVID. The Delta variant is spreading real rapidly, and it spreads a lot faster. We have to really be careful because each breath is precious, and we just need to take time to really look into what we're denying ourselves the right to. It's free. There are sites all over. Every week there's a site. Dr. Gandy's church has a vaccine coming up soon. Dr. Gandy, what day is that going to be on?
October the 9th, and it's on a Saturday. So it was one of the most convenient days that we could choose. And I know Kaiser Hospital is reaching out to other faith-based and places of worship to hold sites for the same thing. So these sites are available, as you said, and it's free. In fact, they're even incentivizing people with gift cards and refreshments and things like that, just to make it more, to ease some of the anxiety around it. And then people they're taking that and running with it. Well, now they're trying to pay people. No, they're not trying to pay you that's just a way to incentivize, those people that are on the fence about taking the vaccine. So.
Right. And so your vaccine site will be October the 9th. Can you give us your address, location that'll be at?
The address is 2425 Cutting Boulevard in Richmond. We're right on the corner of 25th, South 25th and Cutting Boulevard. And so they can come that Saturday. They don't have to register. They can they're accepting walk-ins as well. So.
Thank you so much. I'm just trying to pull up a quick address because I should have did this earlier.
Yeah, and also there are some flyers available at our church, and I think I even have it on my Facebook page as well. So if they need any information, they can go to Thomas Mark Gandy at Facebook and get that information.
Thank you so much. On September the 4th, we'll be having a vaccine site at 2621 Shane Drive in Richmond. That's at the Sojourner Truth Presbyterian Church. We'll be starting at noon till 3. We're going to have some incentives. We have some gift cards, and we're going to raffle off some bicycles for people 12 and over who come out to have the vaccine. And we're going to have some good jazz going. I love jazz. So we're going to share some jazz with our community. So come see us then on September the 9th. And following on October the 4th at that same location, 2621 Shane Drive, they will also be having a vaccine station there. So we hope to continue to be able to reach out to our community and share information. You can follow us on African Americans, the Vaccine and the Virus and the Vaccine on Facebook, or Vax, VACS, Black, BLACK, also on Facebook. We keep information and up to date based on the CDC, Contra Costa Health Services, information on sites and what's going on with the virus happening in Contra Costa County. Thank you all for being here tonight. Have a great night. Love you.
Love you too. Thank you so much, DeWanda.
Thank you. Bye.